Welcome to Beauty Wellness Hair Care. We are going to transform this hair. We created a custom hand-tied hairpiece for his crown area. We're going to do a sew-in hair weave for the crown area. Look at it. This is the after. Look at that crown. We added collagen treatment to his natural hair. We dropped an ammonia-free demi-permanent hair color on his hair, and we razor cut it so that it would all fall naturally. Androgenetic alopecia is a result of a deeper medical condition and should be diagnosed by a doctor.
The cells of the hair matrix are responsible for hair growth and receive nutrients from a capillary loop at the dermal papilla. During the anagen phase, the hair matrix actively proliferates. New cells are continually produced and pushed upward, where they differentiate to form the hair shaft. After the 2 to 6 year anagen phase is complete, the follicle moves into catagen transition phase. In this phase, matrix cells cease activity and hair growth stops. The base of the hair shaft keratinizes and migrates upward away from the papillary blood supply. Finally, the follicle transitions into the telogen phase, where hair transforms into club hairs and migrate up the hair sheath. At the start of the new anagen phase, the follicle regrasps the papilla, the blood supply reconnects, and a new hair grows. The old club hair naturally sheds as the new hair grows to the same depth and thickness as in the previous cycle. Now let's examine what occurs to hair cycles in androgenetic alopecia. Androgenetic alopecia is associated with increased levels of certain androgens in hair follicles that ultimately lead to shorter anagen phases and longer telogen phases. These changes lead to progressively shallower follicles and thinner hair fibers over time.
And that's what we're dealing with in this instance. Very, very shallow hair follicle and very thin hair fibers. Over time, each individual hair's diameter in the crown area gets smaller and thinner. Men and women suffer from androgenetic alopecia. It kicks in after 50. It's hormonal related. Thinning starts in the crown and temple for men and throughout the head for women. This is our hand-tied custom hairpiece that we created on a French silk base. The color is amazing. We gave him bangs and we left them a little thinner so that it would look more natural. Look at the crown. He has a natural wave to his hair. You really couldn't see in the before pictures because the cuticle layer is so fried, but we went in and nourished his natural hair with a collagen treatment. We dropped a demi-permanent hair color over the whole thing to make sure it was flawless. This crown piece hair weave looks fantastic. We added individual eyelash extensions to complete the transformation. We didn't want anything too gaudy. We wanted it to look natural. This is the before picture of his androgenetic alopecia. And this is the custom hand-tied crown hairpiece that we sewed onto the crown area. This is a sew-in crown piece hair weave. We measured the crown alopecia area from front to back and side to side. Then we created this custom handmade crown hairpiece on a French lace base. The transformation is complete. Look at those lashes. They look so natural. I just love the Mink individual eyelash extensions. Sometimes a little is enough. And that goes for eyelash extensions and hairpieces. You want the weight of the hairpiece to match the weight of the client's natural hair. When you're adding hair, you want to make sure that you match the density, the texture, and the diameter of the client's original hair. And that goes for a custom hairpiece or individual eyelash extensions. Do you want to learn to create your own custom hand-tied hair pieces? I think we need to create a textured hair extension class. What do you think? Come visit us at beautywellnesshaircare.com.